Welcome to part 2 of your key physiology of the kidney. This is part 2 of 3. There are 3. So we'll cover just a few things quickly, that then we move on to part 3, and we should have covered the important things in the key physiology and anatomy of the kidney. Okay, so there are 3 basic renal processes. Remember session 1, we're talking about the purely anatomy mainly. Now we're talking about more of the physiology. There are 3 basic renal processes that you need to know. Okay, remember, there's glomerular filtration. That's one of the 3 basic renal processes. Then you have tubular reabsorption, and we have already defined this in session 1. And then we have tubular secretion. Remember, tubular secretion is a movement from your peritubular capillaries to your tubular lumen. Okay, and finally, some sources do add a 4th one. Okay, what you call excretion. Okay, so this can also be thought of, so it's a plus minus, but it can be thought of as one of the renal processes depending on where you are reading. Okay, a common terminology that typically comes up is what we call GFR. Okay, GFR is of course glomerular filtration rate. Now, what is the glomerular filtration rate? Although we'll describe it a bit later and more so in the second session, is the volume. Remember, there is blood coming from your afferent artery. Is the volume of fluid that managed to be filtered from your glomeruli, which is your network of capillaries, into this blue structure that you're seeing, the Bowman's capsule. Okay, how much fluid was filtered from the glomeruli to the Bowman's space, and it's calculated as a rate. Remember, it's R for rate, and so it has a unit of time, per unit time. That will be what we call glomerular filtration rate. So that's very useful to know the definition. Okay, we'll touch on that a bit later. Now let's look at this diagram. Okay, so I'll just there's a lot going on here, but hopefully you can clearly see that this is a Malpighian body. Okay, so what you're having is the vessel that comes in that supplies the blood to your glomeruli essentially is your afferent arteriole. Okay, as you can see, it bifurcates into this meshwork of capillaries that we call the glomerulus. Okay, and if you are looking as it comes out, remember it has to come out somehow. It comes out with what we call the efferent arteriole, as you've seen in session 1. Okay, what else are we seeing here? So this green structure that you're seeing here is actually part of the distal convoluted tubule. Okay, and particularly this yellow colored area here that you're seeing here, these are very specialized cells that we call the macula densa. Okay, which we'll come to a bit later now soon. Okay, so this is actually a part of your distal convoluted tubule that has a macula densa. Okay, as you're seeing, this is the meshwork of capillaries that we call the glomerulus. Now, before we move more into the glomerulus, you can see these cells that line mainly the afferent arteriole, although you still find it in your efferent arteriole. This is what we call the juxtaglomerular cells. Again, we'll touch on it very soon. Okay, and finally, if we are to take this piece of your glomerulus and we enlarge it, you see a magnified picture, which is what you're seeing here. So there are these cells that we're seeing here, what we call the mesangial cells, which we'll discuss very soon. And then you have, of course, your glomerular capillary that you have, and of course the capillary is lined with podocytes. Okay, now we have a brief overview. Now, what are these cells that we are seeing? Number one, we are definitely seeing the mesangial cells. Okay, now what are mesangial cells? Okay, mesangial cells, although they are not really known the true function of it, we do know that they form part of the structure and support. Okay, that's a key main thing, the structural cell that supports especially what we call the vascular tree. Okay, they also, however, are also contractile. Okay, and produce actually some vasoactive substances that help control your blood flow. Okay, but always think of them as the structural cell that support your vascular tree. Okay, but the function of these cells aren't really very well known, or are not so clear beyond this. Okay, then these cells that we've mentioned here, they are juxtaglomerular cells. Okay, they're also known as granular cells. So what are these juxtaglomerular cells? So you will notice that there is what we call smooth muscle cells. Okay, these are small muscle cells that line typically your afferent, okay, your afferent arteriole, okay, and they produce, and the key thing that you need to know about the juxtaglomerular, they produce, they store, and they secrete renin, okay, which we'll talk about more of the RAS system in session 3. Okay, that's the goal, that's the main mechanism of action of your macula densa, okay, sorry, your juxtaglomerular. Then finally, we have mentioned these specialized cells that are in the distal convoluted tubule, what you call macula densa, that you are seeing there. Okay, so what are macula densa? What you need to know about macula densa is that they're typically closely packed specialized cells of the distal convoluted tubule. Okay, typically we find them between, just from your thick ascending limb as it enters your distal convoluted tubule. That's where you find them typically. Okay, but what you need to know is that they are very sensitive to the concentration of sodium chloride. Okay, salt. Okay, very very sensitive to it. Okay, so for example, if you have a decrease in your sodium chloride, what happens is that it initiates a signal from your macula densa, remember your macula densa, which has two main effects. Okay, number one, there will be a decrease in the resistance of blood flow. Okay, there will be a decrease in the resistance of blood flow in the afferent arteriole, which of course will raise your glomerular hydrostatic pressure and help retain your GFR back to normal. Okay, the second mechanism is it increases renin, okay, which is of course released from your juxtaglomerular cells that we have just described here, and which of course houses your renin. Remember, it stores, secretes renin. Okay, again, effects of renin, we'll cover them in session 2. Okay, so that's useful to have an idea of what the macula densa is. Now the question is, what is a normal GFR? Okay, we are back to GFR. Okay, we're just giving a bit of some physiology there. Otherwise, we're back to GFR. Okay, what's a normal GFR? Typically, a normal GFR is anything greater than 90, and the unit is mil per minute. Remember, it's a rate, but we calculate it over space, so 1.73 meter squared. Okay, of course, this is what we call estimated glomerular filtration rate. Okay, remember your normal GFF, what you call GFRR, is 125 mils per minute, and that works out to be around 180 mils per day. Okay, so their normal GFR, this is how you present it. Okay, now how do you decrease? What's the mechanism behind, let's say, decreasing your GFR before we talk about how factors that affect it? Okay, so just to give an overview. Okay, so for you to decrease your GFR, for example, one of the ways that you can do that is if your afferent arteriole, okay, constricts. Okay, if your afferent arteriole, remember afferent is the one that comes in, if it constricts, obviously there will be an obvious decrease in your hydrostatic pressure because there's there's reduced blood flow towards the glomerular, and so that inevitably decreases your GFR. Okay, it's the same with the afferent. The moment you dilate it, okay, that means you almost exclusively decrease your hydrostatic pressure and your GFR drops. Okay, so that's just the mechanism, one of the mechanisms how your GFR is decreasing. Okay, that was just to highlight, to understand what is following. Now, what are the factors that affect your GFR? Okay, whenever you're asked this, always say it can be intrinsic and extrinsic. Intrinsic simply means it's the renal system itself auto-regulating, what you call auto-regulation. Okay, so that means it's the renal system itself doing it. And extrinsic, it means other external factors affecting that. Okay, auto-regulation can be in two main mechanisms. We call one of them myogenic mechanism. Okay, because of the lack of space, I'll just explain here. Myogenic, remember your myogenic response refers to, of course, the contraction initiated by your myocytes. Okay, so what happens is that in response to changes in your pressure, especially in renal blood vessels. So, for example, if you have an increase in arterial blood pressure, okay, if your blood pressure increases, you obviously have increased stretch, okay, because there's more pressure in your afferent arterioles, okay, which eventually for the kidney, for it to reduce that pressure, it will have to constrict the arterioles. So they constrict, and then you drop your GFR. Okay, so that's one way. By myogenically contracting the lumen, it changes your GFR. Okay, that's the myogenic mechanism. Now, for tubuloglomerular feedback, okay, it does include an element of understanding RAS, which will be part of your session 3. However, remember your juxtaglomerular apparatus that we've mentioned about, okay, it monitors fluid entering the distal tubule and adjusts the GFR. So for example, if you have a high GFR, okay, there's rapid flow of the filtrate in the renal tubule, of course. Then it's, of course, remember, because there's more sodium chloride, it's sensed by your macula densa. Okay, there will be, of course, paracrine secretion, constriction of your afferent arteriole, and eventually reduced GFR. Okay, so that's useful to know. So it's the kidney itself. Okay, so this requires understanding the RAS, which we'll talk about in session 3. Extrinsic is referring to the external factors affecting that. Okay, remember your all blood vessels of the kidney. Now we are talking about the sympathetic control. All blood vessels of the kidney are richly innervated by sympathetic nerve fibers. Okay, it's this strong activation of the renal sympathetic nerve that constrict the renal arteriole and eventually decrease your renal blood flow and GFR. So that's basically the flow. Okay, and you can read more on that. Otherwise, I'll quickly touch on hormonal control. Okay, remember your norepinephrine, epinephrine, endothelin constrict renal blood vessel naturally. We know. Okay, and of course, what will that happen? It will decrease your GFR. Okay, we know angiotensin 2 constrict efferent arterioles. Okay, and other things like prostaglandins and bradykinin causes vasodilation, which will increase renal blood flow and increase GFR. Okay, so those are just some of the hormonal control that you can expect in changing your glomerular filtration rate. Okay, and quickly, the last thing that we discuss here is what we call filtration fraction. Okay, so what's filtration fraction? It's actually a percentage, okay, of what you call the renal plasma flow, okay, renal blood flow, renal plasma flow that is filtered. Okay, so what percentage of the renal blood flow, if a renal plasma flow, is filtered across the glomeruli as opposed to the blood that goes back into your efferent going back to the blood? Okay, it's typically expressed as a ratio. Okay, so what you want to do for your filtration rate is your GFR, which is the volume of blood filtered per unit over your renal plasma flow. So your total amount of flow in your blood and your GFR that managed to get out into the Bowman's capsule, how much of it? And it's typically anywhere around 0.2 as a unit, or you can convert to percentage to be around 20%. Okay, remember angiotensin 2 constricts your renal efferent arteriole, which increases your filtration fraction, thereby maintaining your GFR. Again, we'll touch more on the RAS system in the next session. I thank you.